beach management unit. We are training BMU leaders with key HIV prevention messages. We are training both men and women who are involved in the fishing business. And, one BMU leader has capacity of leading about 700 fishermen. And so as National Syndemic Diseases Control Council, we are reaching out to around 140 of these BMU leaders here in Kisumu. And so we are hoping that as we train them to be TOTs and peer educators, they're able to cascade the information that we are going to give them. We are giving them information about HIV prevention, of course the common ABCs of prevention, abstinence, behavior change, and use of condoms. We're also talking about the use of, PrEP for those who need it, the use of PEP for those who need it, and those who are already, infected, we are actually encouraging them to stick to their treatment. We are working with people from the Ministry of Health. We are working with people from gender department because we are talking about gender-based violence, which is common among all these mobile populations. We are also talking to the beach management unit leaders about the issue of teenage pregnancies. We know along the beaches, because of the cash flow, it is easy to have sex for fish. It's easy to have a lot of sex, transactional sex, because of the free cash flow. And so we want to have allies out of this. People can help us to fight the issue of teenage pregnancies along the beaches.
You realize the level of awareness is about 100% that HIV is still with us, but the corresponding behavior is not 100%. So we still need to do a lot of advocacy using the Ngao network from the regional level down to the village where we have the village elders, so that we continue sensitizing our people against contracting this disease.
Before it happens, it starts in the community. So really, by the time somebody comes to the hospital, it is too late. So we are very interested, the Ministry of Health is very interested in keeping people away from the hospital, and that means that the things that are happening at the community are critical to prevent somebody becoming a patient who needs our care.